Well, listen, I think it means a lot to our staff. I think that people are been waiting for this for a long time. So I think the staff's enthused. Remember, the frontline caregivers are doing all the work here. And for them to feel that they can be safe and also safe for their patients. So there's two sides to this coin, right? It's themselves, but really then they're protected. They won't be at risk to their patients. So I think they're all pretty excited about it. So today, we wanted to be out here doing it first, just demonstrate that we think it's safe. We want to have it. We want to encourage everybody to have it. So there's a balance between whether we should do this or not. And I think most of our folks thought it was important to do it. They said, set the example. We're going to do it. We're standing behind it. And it's not a mandate, right? So we're encouraging as many people as possible to get vaccinated. So I think it was pretty important. I mean, I also have the pleasure of taking care of older patients myself. So a lot of them don't want to see you if you're not protected. So they're really more concerned. So for me, it's also a clinical issue. This is the time where we can go and fight it without having to be on the passive side of things. This is our chance in the healthcare system to prevent the disease, make people safe, and get through this next few months. So it's really, really, really important. There are different scenarios, right? At Kent, we're more COVID-centric. There's a lot of COVID patients. There's a lot of activity down there. Here, we have a lot of pregnant women, a lot of women coming in that are worried about that, and we have positive patients here, not as many as Kent, because their individual hospital functions are still specific to them. So even at Butler, and some of the Butler staff is here because they don't have their allocation yet, but it really is important to them because if one of them gets infected, we have to shut down a whole unit. So I think universally, it's important for all of them. We've heard people say light at the end of the tunnel. One of my colleagues said the eagle has landed. I mean, this has been pretty important for everybody in this region, especially here. So people are excited as hell. So I think, again, it's like Christmas morning, waking up, the Christmas tree has this big gift. Now we got thousands of doses. We can treat all of our direct line caregivers. We're raves first, the ones who are most in contact with patients and our others. It's incredibly exciting.